Inside the Law is presented to educate listeners in Monmouth and Ocean counties about legal issues. The opinions expressed by the host, guests, and phone callers are strictly their own and do not necessarily reflect those of Town Square Media and are not intended to be a substitute for personal legal advice from your own attorney.
Your questions and comments are welcome at 732-505-1160. Inside the Law, talk radio for the Jersey Shore.
Good morning, ladies and gentlemen. Welcome to another live edition of Inside the Law, brought to you by the law firm of Novy and Associates, your elder law specialist here in Ocean and Monmouth County. As always, we like to give you, the listener, updated information about legal, financial, and in some cases health issues, but things that are related to you, our active adult senior, which is a large part of our population, both here in Ocean and Monmouth County. We're presenting our show today on 1160 WOBM-AM in Ocean County, 1310 AM in Monmouth County, and all over the world on WOBM-AM.com. As always, we welcome any questions, concerns, comments, or observations that you might have about today's show. Our phone lines are open. Our sound engineer, Paul, is waiting to field your questions. So if you have one, please feel free to call us at 732-505-1160. And as always, I encourage you to have a pen and paper handy because we always give out a lot of important information, phone numbers, dates of upcoming events, and much, much more. So welcome to today's show. With me today are two friends, colleagues, who are very relevant to what we do in Ocean and Monmouth County because it deals with elder law, elder care, and aging in place. So please welcome two ladies I've had the pleasure and privilege of working with for a number of years. Joan Wills, who is the Assistant Vice President of Geriatrics at Monmouth Medical North, and Denise Gaffney, who is Foundation Chair of Monmouth Medical South in Lakewood. And our subject today will be, among other things, talking about geriatric emergency care at Monmouth Medical, Monmouth Medical's Better Health Program, and various outreach programs which you, our adult senior population, can take advantage of to, as I like to say, age in place. Good morning, ladies.
Good morning, Bob.
Good morning, Bob. Thank you for having us today.
Thank you for coming on. It's so important as to kind of set the stage and to set the table, if you will. As we all know, our senior population is a significant economic force and a significant part of our population in both Ocean and Monmouth County. I was recently reading an article that says that today, every day, over 10,000 people each day are turning age 65 and over. And I think one of you said that our largest growing population are people over the age of 85.
Mm-hmm. Yes.
So these are incredible numbers. So, Joan, if I may, tell us a little bit about your background and how you got into geriatrics. And then, Denise, I'll ask you a similar question.
Oh, thanks, Bob. First of all, thank you so much for inviting us to be here today.
Our pleasure.
I'm a registered nurse, been a nurse forever.
Like my wife.
Right?
Like me.
Absolutely. I have a master's degree in public administration and also have a credential in quality. So I'm a certified professional in healthcare quality. So quality is really an important part of what we do. It's really the secret in healthcare. And I started in geriatrics back in the early 2000s as a certified assisted living administrator. Did that for a couple years. Then I came back to Monmouth to do a Robert Wood Johnson Foundation grant for the frail elderly with dementia. Through that grant, we put together programs that reached more than 400 individual patients with dementia, elderly, all over the age of 65. And from that, we really learned lots of things that are needed out there in the community for this population.
And there's so much that's misunderstood about dementia, what it is. As you know, it doesn't always mean Alzheimer's. Dementia can take many forms, and it doesn't necessarily have to be a permanent, continuous downward spiral if it's properly diagnosed and caught early on?
Dementia is a complicated thing. Our brains are really complicated. I think that's the best way to think about it. When dementia occurs, there are changes that happen in your brain. So for each of us, our brains are different. So when it comes to dementia, it's different in every individual. It's about the human condition.
Right.
So with that, you have to be prepared to deal with what happens on the day-to-day because you don't know which the next change is going to be.
Exactly. Now, Denise, you mentioned at the outset that you're also a nurse.
I am, Bob, for longer than I want to admit to as well. But I have a whole continuum of nursing, starting from pediatrics and ending up in geriatrics. And then
The entire spectrum.
Yes, I have. But the nice part where I am today is I run the foundation for the medical center, which gives me an opportunity, being a nurse, to see the needs of the medical center and understand what we need in place there so that I and my team and my foundation members can raise money, of course, for these services and technologies and whatever the medical center actually needs. And that has given me much joy, and I'm happy to say that actually what we're going to talk about today has been partially funded by the foundation board, and I thank them for that. And so as we go along, we'll talk a little bit more about the services and the programs that we're going to implement here.
Well, it's interesting because you mentioned the grant that you received, Joan, from Robert Wood Johnson, which is public record, public knowledge, is becoming part of the Barnabas system. So that has to be a very exciting new opportunity and resource for the entire Barnabas system to be able to offer to the community.
It's extremely exciting. We really know that this is going to help us to really improve the care that we're giving across New Jersey.
Exactly.
And the Robert Wood Johnson Foundation, of course, has done so many wonderful things for evidence-based medicine, improving what we do. Also, the medical center at Robert Wood Johnson has all kinds of things to offer. So we're very excited about being a part of that.
So yes.
And if I could just set the stage for what we're going to talk about.
Okay.
The way healthcare is moving forward, the government is challenging us to take care of populations of people. And by that standard, we need to have the Robert Wood Johnsons in our system so that we can take care of everyone in New Jersey and with the services that they need. And today, our goal is to keep people out of the hospital. You're going to see that we're going to try to keep people healthier and well and keep them living a better life, so that the end goal is not an admission to the hospital, but to stay at home and be healthy and vibrant and healthy. So this is part of all of the setting the tee up to keep our population healthy, including our seniors. And, it covers the whole spectrum of healthcare. It's not only about dementia, but, just keeping them healthy, keeping their diabetes under control so that they don't need an amputation down the road, keeping their heart disease under control so they don't need open heart surgery. It's all about wellness and education.
So what programs are in place at Monmouth Medical, both the North and South hospitals, the one in Long Branch, where Joan principally works out of, and Monmouth South, formerly known as Kimball, where Denise, you primarily work out of. What are some of the programs that our seniors listening to today's show on Inside the Law can learn about as far as resources and education that they can take advantage of to age in place and to avoid that accident from taking place in the first place? I always like to say to my clients, it's a lot more efficient and less expensive, both financially, socially, and otherwise, to prevent a fire than having to put one out.
Right.
So what are some of the resources that are available to our seniors listening to today's show?
In my regional role,
yes.
I just wanted to say that Joan is actually in charge of the geriatric program at both campuses.
Okay.
So she has a
That's been pretty
role.
exciting for me. We at the Monmouth Medical Center campus is where we started with in really enriching the programs that were already in effect for quite some time there.
Okay.
Dr. Jessica Israel is the geriatrician who really leads our initiatives for geriatric health. And we really do talk about geriatric health now, not just about chronic illness. The hospital has historically been the silo, the place where that's the only place that we're looking at patients when they arrive. Today we know that we all need to be looking outside the walls and look at health across the continuum. So Dr. Israel has really been extremely effective in putting together programs that really meet those kinds of needs. We have a geriatric outpatient health center, and we are now moving those programs here to the Southern Campus. I've had some responsibility here for now over a year, which has been an interesting introduction for me. Ocean County is not Monmouth County, and Monmouth County is not Ocean County.
Okay.
I've heard that for years, but didn't really appreciate it till I've actually lived it here for the last more than a year. So the programs we're putting in place here are very specific to the geriatric population here.
Okay.
We have put in a geriatric emergency medicine program. Next, we're looking at an acute care for the elderly inpatient unit that will be opening in September. Really exciting that the foundation has been amazingly supportive of. It's been so wonderful to have them to recognize the work that we're doing. Okay. And then we'll also have an outpatient geriatric institute. So.
Okay. We're going to continue to expand this conversation, but before we do, I want to remind our listeners that you're listening to 1160 WOBM-AM in Ocean County, 1310 AM in Monmouth County, and our phone number here at the studio is 732-505-1160. And Paul, I understand we have a caller patiently holding on line one.
Yes, we do. This is Sue in Lakewood.
Sue, thank you. Welcome to Inside the Law. How can we help you?
Thank you very much for taking my call. The show is very interesting. A neighbor told me, I do live in Lakewood, and a neighbor did tell me about a new program at the hospital, or the hospital is starting, and that's called the Better Health Initiative. Can you tell me more about that?
Please.
Yes, we would love to. We were going to get to this. This is a program. It's called Better Health Membership. It's entirely free. You would call and register, and what this allows us to offer you as a member of this Better Health membership is educational programs, health screenings, access to health coaches, access to physician in-services. It also gives you some additional perks, such as if you call for an appointment with a physician, you would get that appointment within 48 hours. If you come in for blood work or x-rays at the hospital as an outpatient, you would have no waiting time. You would have preferred parking. You would get a discount in the cafeteria, the luncheonette. And it also, we're also building into this program a social component. And there are going to be opportunities to attend social events that are actually fun and educational, such as maybe a food and wine that teaches you the healthy foods that you need to eat while you're having that healthy glass of wine. Or the New Jersey Symphony may come and present in the community. If you're a member, you'll be invited. So it has a lot of potential. And we just started this program a few weeks ago, and we already have over 200 members that have registered. Wow. And it's very simple to register. We could talk about that a little bit. And we're going to grow on it. We're going to grow this program. It will expand, hopefully down the road, once we've established this program, to have discounts in the community. We're going to look to partner with businesses so that if you go to the local appliance store, you may see a sign in the window, that says if you're a member of the Better Health program, you'll get a 10% discount.
Or maybe with a car dealer or a restaurant or whomever.
There's many, many facets of this that we can build upon, but right now we have those basic offerings that we're offering to you.
So, Denise, if Sue or any other person listening to today's show on Inside the Law would like to learn more about the Better Health program and possibly become a member, since it is free of charge and it's a great resource that people can take advantage of, how can they learn more about it and become a member?
Absolutely, Bob. Thank you for that. You could call 732-886-4731. And I don't know if you're a computer person, but if you wanted to visit us online, it would be barnabashealth.org/betterhealth and click on Join Now. So there are two ways of joining the program at this point. And when you join the program, you will receive in the mail within a week or so a complete packet of information along with your card, along with a parking permit that goes in your car, and all the information about the services and educational programs and screenings that are available to you as a member.
Now, Joan, can you explain to me, I'm sorry, Sue, was there anything else you want to ask us?
No, I want to thank you very much for the information, and I will be continued to listen to the show for the rest of the morning.
Great.
Thank you. Thank you for calling.
Thank you, Sue.
And
we look forward to it.
Want to wish you a happy and enjoyable weekend, and thank you for spending some of your Saturday morning with us on Inside the Law. Thank you.
Thank you.
Bye-bye. Joan, can you explain to our listeners what a health coach is? What does that mean?
Sure. A health coach is someone, we have two, Peggy and Kelly, who are really wonderful. They connect with you as an individual and help you to get from one step to the next in our complicated healthcare system. We kind of joke professionally that it's hard for us, that healthcare today is pretty complicated. So what we've done is we have these two women, Peggy and Kelly, who you can see on the website if you go on the website, who will actually speak with you and help you to make an appointment. If you have a question about healthcare, help you to get into the right direction where the answers could be. They've actually developed on this website that you can go to, lots of information with connections to other places. They also do educational programs in the community.
I'm glad you mentioned that.
They do lots of education out in the community. And we look to each of the seniors as individuals to tell us what they're looking for out there.
Exactly.
So we're not only delivering what we think are the right things, but we really want to do what you think are the right things.
So as an example, if someone has recently moved down to Ocean or Monmouth County and they're looking for new doctors because it's not convenient for them to continue to drive up to Hudson or Bergen County or back to mainland Philly or New York City or wherever they come from, they can find and get names of new doctors that can consult with through the Better Health program?
Yes.
Okay.
They definitely can do that. Also, it gets pretty complicated out there depending upon which kind of health care coverage you have and who is and who isn't. They can help guide you to who you need to call to be able to find out with your individual insurance what the opportunities are. You might get a list that are then part of that and go back to them and say, gee, could you help me with this? And they'll help you not only to identify the person, but also then to get the appointment.
Now, along the lines of information and education, if someone listening to today's show is an active senior and they're involved in a senior group in perhaps a senior community, which we have about 85 or more of them in Ocean County alone, and a number of them in Monmouth County as well, and they'd like to have a specific program presented on some of these subjects and maybe others we haven't yet touched upon, who would they call to ask for one of your speakers to come to them?
We're using that same number for Better Health.
Okay.
We're using that one number. Call us, and we will get back to you. We're pretty excited about this Better Health program because for seniors, what we've recognized is better health is more fun. If you're healthier, you're having a better day. So that's a real good reason to be paying attention to better health.
Exactly.
And we can do medical lectures every day on all kinds of medical things. What we're finding is that sometimes it's easier to listen to the chef who's telling you how to actually make that healthy meal so that you can have a healthy day. We really look at your diet and exercise, extremely important. Socialization. Socialization's key. So that is part of the Better Health program. We'll have programming that is fun, that's educational, and also speaks to how you can be healthier.
Those are all good points to know. Now, with the population that is aging here in Ocean and Monmouth counties, people sometimes frequently present themselves, appear at the hospital. They may frequently fall. They may have common problems that are haven't been properly addressed, whatever that might be. And it can be overwhelming for a health system, especially with the number of seniors that are now in Ocean and Monmouth County. And as we all know, Medicare is starting to penalize health systems where a patient comes to the hospital, is discharged and reappears 30 days later or less than 30 days later with the same problem. So what is this GEMS program all about, and how is that hopefully going to help with those kinds of situations? If you can explain it. What is a GEMS program, first of all?
Okay. Lots of really good questions in there.
Okay.
GEMS is a geriatric emergency medicine program. And that means that when you come to the emergency department, when you're over the age of 65, you're assessed to see if you would benefit to be in this particular portion of the emergency department, where we have special lighting. It's a little quieter. You know, it's for some people going to the emergency department and being in the middle of the, quote, chaos, because emergency departments are chaotic. I was an emergency nurse for more than 17 years, so I really get that. So being in a different area is really good for our seniors, where still the same level of care can be provided, but in a way that approaches you that is specific to you and your needs.
Okay.
So that's really what the geriatric emergency medicine program does. And then when you get admitted to the hospital in our new acute care for the elderly unit, your needs will be addressed as they need to be for you, just as we have pediatrics, which is a specialty for children because the care of children is not exactly the same as it is for others. So for geriatrics, for our patients over the age of 65. Now, some of us are not liking being called geriatrics at the age of 65. I totally get that.
Right.
But we know that, again, that 85 and over is really growing. And the 85 and older have children who are 65. So we're really challenged these days, being sure that we get the programs in place that are meeting the individual needs of this age population. That's what we're doing.
Yes, Denise.
Sorry. And if I could add to that, I think that's a great explanation of the GEM unit. And how I put it very simply, when you're in the GEM unit, you're being taken care of holistically by a team approach. You have geriatricians, geriatric nurses. You also have a pharmacist, which is so important to looking at your medicine and what you're on. Because, say for an instance, if a young person fell and broke their arm, they'd go in the emergency room, it would be fixed, and you'd be sent home. If a geriatric person got into the emergency room with a broken arm, they'd say, well, why did you break your arm? Did you break your arm because your balance is off? Did you break your arm because you fainted? Did you break your arm because maybe you're on medications that are interacting with each other? They'll dig down deep and discover, what caused this particular event. So I think it's really a wonderful approach that they're looking at everything and really treating you holistically to get you better health and better on the road. And
I know one of the challenges there is that I see it with our own clients at Novy and Associates. Some people are not good historians. They don't remember all the medications they're on, all the doctors that they are seeing, who's prescribed what, when they last ate, when they're taking the medications, did they remember to take it today or what have you. And that alone can add to the confusion and what's commonly called polypharmacy,
right,
which can be a component of dementia or diminished capacity on a short-term basis. So are there ways that the hospital going forward can kind of track if a patient, let's say, becomes a member of Better Health and registers with the hospital system? I know the hospital has a new computer system called Cerna, where a lot of criteria and information about that patient can be stored and easily accessed anytime they reappear at the hospital, if they're a part of the Barnabas system, where the information about that patient be kept on hand so the hospital knows enough about or more information about the patient. So if they have to be treated, you can treat them quicker. If we can avoid admitting them, we can. Or upon discharge from the hospital, we know what their resources are, what their insurance might be, and whether or not they're family members or friends and or other advisors that they have hired and are in place to receive them back home. Because I know that's part of the problem that can delay a discharge from a hospital if the hospital doesn't know if there's anyone who can receive them home after they are treated for that broken arm or that hip surgery or that stroke or what have you. So can this hospital system access if a patient or a client or patient registers with the hospital and this information is presented while my client, your patient, can give you the information, is there an opportunity or an ability to store that so if you need to access it in the future, you can?
Mm-hmm. The computerized systems have been such a positive in terms of what you have just described.
Right.
So that the information is stored. When you come, if you were here, if you were at the hospital a month ago, 6 months ago, a year ago, we're able to actually bring up right on the computer what the information was when you were here that 6 months or a year ago from the time that the computer was implemented. It really is a very positive improvement. Having said that, your situation changes on a daily, on a monthly basis, and it's really incumbent on us to be sure that the information that we have is the current information for today.
Exactly.
And so we do need to be constantly updating that. And I would ask our listeners to be sure that the information that they bring with them to the hospital is current. Having information on hand, so if you have to come unexpectedly, and that information actually comes with you, who is the caregiver? Who is the person that you would want to be contacted? Has there been a change in your medical condition? Bring that with you. It makes us better able to meet your needs in that moment in time. So,
go ahead, John.
I just wanted to also say that Denise talked about falls, and we're talking about the geriatric emergency medicine. One of my passions is avoiding those falls in the first place.
Absolutely.
We really know that. I've just recently read an article that 4 in 10 of people over the age of 65 will fall in the next year.
That's scary.
Isn't that scary? There's a bigger, scarier number. 75% of those who fall and fracture a hip will not get back to their baseline. So the key for us is to avoid those falls.
Absolutely.
That's how we get back to this Better Health program. At Monmouth Medical Center Southern Campus, we really want to be focusing on how to avoid that fall. How do you look at the safety in your home? First thing you can do, make sure you pick up those slip rugs.
The throw rugs. They're slippery and people trip over them. You're right.
They truly are. Look in your bathtub. Look in your shower. Do you have one of those plastic mats that really isn't holding very well?
And along those lines, from the bathroom point of view, you have a grab bar.
Yes.
In the shower.
Please don't grab that towel bar because it comes right out of the wall, and what happens? Something is broken.
Exactly.
And life changes.
Now, do you have, as part of this team approach, does the hospital have available people that can go out to the patient's home to help do an assessment to see if there are those inherent risks that they may not realize are out there and can help the client identify and eliminate those risks?
Barnabas Health Visiting Nurses really focuses on that.
Okay.
I think also if you go online, there are many very simple safety checklists. You just have to Google safety at home, and there are checklists that come up that are very simple, that you just kind of walk through the house and look at these things that we've just talked about. Believe it or not, most people don't do it.
Exactly.
So if you are over that age of 65 and don't want to fall, I personally fell in my shower about a month ago.
That's embarrassing.
So I swear, this is my new passion.
Oh my goodness.
It's really not embarrassing. It's a message to get out there. I had one of those mats in the bottom of the shower that I had newly bought.
Okay.
Went right out from under my feet.
Wow.
And I'm fine, thank you, God.
Thank God.
But it could be a much different situation. So please look in your shower. If you've got one of those mats, get the kind of strips that you actually put in the shower.
Yes.
That don't have the possibility of coming up under
loose
your
or
feet.
discharging.
So let's all pay attention to
I
not
want to remind
falling.
our listeners again, you're listening to 1160 WOBM-AM in Ocean County, 1310 AM in Monmouth County. Our show is known as Inside the Law. Our phone number here at the studio is 732-505-1160. Our phone lines are open if anyone has any questions. And I'm your host, Bob Novy of Novy & Associates, your elder law specialist in Ocean and Monmouth County. And with me today are Joan Wills, who's a assistant vice president and geriatric advisor with Monmouth Medical North, and Denise Gaffney, who's assistant vice president, or is it vice president?
Vice president.
Vice president, sorry.
No problem.
And she is the foundation chair at Monmouth Medical South. And we're talking about geriatric medicine, aging in place, and things that we can all do to protect and preserve our futures, our safety, and as I like to say, age in place. When we talk about community education, I think it's a good idea to have available a seminar that might include a handout for those safety tips that you were talking about, Joan. Mm-hmm. Another one may be on information that people should have available if they do have to appear at the hospital on an emergency basis or on any basis. For example, when I'm acting as an elder care attorney and helping with a client and dealing with them staying at home with caregivers, sometimes the caregivers are on a temporary or part-time basis. Sometimes it's on a 24-hour permanent live-in basis. If the client has, among other things, has prepared in advance, as we all should have, a current will, an advance directive or a living will, a medical power of attorney, a financial power of attorney, we recommend that copies of these documents are kept at home, that the caregiver that's at home with them knows where these documents are, because if the patient has to appear at the hospital, this information, along with the list of medications that they're on, along with the names of the doctors that are treating them, should all be readily available. I know some of the caregivers we work with literally keep those documents on the refrigerator or in a vial or someplace so that the information is readily available. So if they do present themselves at the hospital on an emergency basis, the documents follow them to the hospital. So the more information you have, you know what their wishes are, you know who their resources are, who to contact, such as family members, attorneys, or anyone else that can help with their return home and be ready to receive them when they are discharged. So that's very important.
That's extremely important.
Exactly.
And
yes,
sorry.
Yes, Denise.
I just want to interject here because we're talking about educating the community. And I know that the transition a little over a year ago, from Kimball Medical Center now to Monmouth Medical Center Southern Campus, a merger with Monmouth Medical Center in Long Branch, which is a teaching academic hospital, has brought us such great strength and quality to our hospital in Lakewood. And I want to let you know that we just recently completed our Joint Commission survey without one, what do they call it?
Deficiency?
Deficiency, thank you. Without one deficiency for patient care, which is really an awesome, awesome deal. We also just recently got a leapfrog score of A, which is a safety scoring. That's the third year in a row that we've received an A.
Congratulations.
So I really think so many good things are happening there. We're trying to get that word out. And one more thing, I'm going to say that we are in the midst of finishing up, along with this renovation for the Geriatric Institute and the ACE unit, all private rooms in the hospital. We're going to have available by probably the end of July, August, at no cost to you or your insurance company. We're moving towards all private rooms for our patients that come. And we really feel this geriatric program that we're instituting here, it's going to be like a destination place. You know, people are going to want to come to know that their parents or their loved ones are being cared by a team of experts. So lots of really great things are happening.
That's exciting. And one of the challenges, talking about this Better Health program, and I understand, Paul, we have a caller on line one. I'll be getting them in a moment. One of the challenges is to get this information out to the public.
Correct.
So, again, if anyone listening to today's show wants to learn more about the Better Health program, wants to become a member of a program that's free of charge and can give you a lot of good, preventative, proactive information, as Joan said, to avoid those falls, to better cope with your aging and how to age in place and enjoy a happier, healthier, autonomous lifestyle at home, which is why we've worked all the years we've worked, and we deserve that quality of life here in Ocean and Monmouth County. Please consider the Better Health program at Monmouth Medical. And again, before we take our next caller, what is that phone number?
732-886-4731.
Okay. Paul, we have a caller on line 1.
This is Kate from Brick.
Kate, thank you for calling Inside the Law. How can we help you?
Hi. I listen to mostly every show, and the last 2 shows have pretty much brought up a lot of great points about aging in place. How does the hospital help the elderly stay in their homes?
A very good point.
Great question.
Very good question.
That's a really great question. We talked a little bit about the team approach. With the team approach to care for those patients who are admitted to the hospital, we really try to keep them as mobile as possible, as long as possible, and look at something called transitions in care. We used to just be the hospital. Now it's so important to get the patient to the right level of care. So first of all, to keep them as mobile as possible as long as they're in. And then when it's time to go home, what resources are needed in that home to be able to keep you at home? Or do you need to go to an acute facility for rehab for a short period of time? Do you need to go to a subacute facility for rehab for a period of time so that then you can become strong enough to then go back into the home? And how do we make that happen? Or when you go home, do you need to have a visiting nurse who's there? Or do you need some other kind of care? Often we find when you go home, you're okay, but you have no way to get to the doctor. It's really important for you to get to the doctor within that week. That's what we've done with the health coaches. Try to connect you with the health coaches so that they can help you to have the right transportation so that you can get to whatever that next step is for your care. The thing is, it's complicated, and our seniors need help to be sure that they're getting the right resources so that they can stay in the home.
Now, we talked about this earlier before we came on the radio, and that is if a patient appears at the hospital and is admitted, how can you keep them active and get them out of bed if their condition permits it so they don't stay immobile too long and that muscle strength starts to deteriorate, which can result in them having to go to a subacute for physical therapy and occupational therapy?
And I think the point we're trying to make here is the earlier you start a better health program, the better. You know, I'm sure there are some seniors out there that have missed that mark already. And so the message is really to the caregivers, to the children that are turning 65, that are caring for 85, 90-year-old parents at home, to keep yourself healthy.
Okay.
You know, and I think you're absolutely right, Bob. It could take 3 days in a hospital bed and you already lose muscle mass and you're deconditioned. So the key, as Joan said, is to keep people out of bed, having their dinner out of bed, you know, getting them the gym compartment, the physical rehab associated with the Geriatric Institute and the ACE program is so vitally important for that well-being and keeping people healthy. You know, when you're up and moving, everything moves better. Your circulation moves better, your heart moves better, your muscles move better. So that is a key component. And I think that, you know, we're trying to put this better health into place, and we want people like 65 to join now, so that you can prevent that not so great outcome in the future.
That's a good point. Kate, are there any other questions along those lines?
No. I find it very informative. Thank you.
Well, thank you. I appreciate the fact that you're a regular listener, and if you or any friend or neighbor I don't want to presume that you're 65 years of age, which is very young today, by the way, I must say.
But, younger every day.
If you or any friend, neighbor, or family member would like to learn more about the Better Health membership program, which is complimentary and free of charge and entitles you to a lot of benefits, just call 732-886-4731, and Denise will make sure that you receive a brochure to learn more about the program. Thank you for being part of our show this morning, and enjoy the weekend.
You too.
Thanks for the great question.
Bye-bye.
You're welcome. Bye-bye.
What is you mentioned, Joan, earlier about the ACE unit, ACE. What does that mean? What does that stand for?
Bob, in healthcare, we're a lot about alphabet soup, in case we haven't caught on to that already. The ACE unit is an acute care for the elderly unit. It is an 18-bed unit that will all be private rooms. We're really excited. The foundation has helped us a lot in that. So there will be special beds. There are actually 6 beds that are special on top of special. So we're really making the rooms very senior friendly.
Okay.
One thing we know is that this is a simple thing, but I was speaking with an audiologist just a couple of weeks ago, and he said to me, Joan, one of the best things you're doing is putting patients in a private room. And I said, okay. And he said, it takes away all the distraction, all the other noise that's happening that makes it very hard to focus when you have any kind of a hearing impairment. So, yes, we have special audiology equipment. Also, we're paying attention to the environment to make it so that it's senior friendly and one that we can promote the better health side of things.
So while they're in the hospital, they're going to have, frankly, to the extent that it's possible, depending upon why they were admitted in the first place, a more enjoyable stay, a more appropriate stay, and the care, I guess, will be more geared to them as a senior?
A senior focus stay. I can go for that. Right. It's really hard for me to say that they're going to be having a good time when they're there. I talk to too many seniors every day who say any experience in the hospital is really tough for them. Right. And we really know that we want to get them to the right level of care as soon as possible and then keep them there.
Is there any special focus or training that the nurses that'll be working in this ACE unit will have? Because seniors, do have special needs. I see it myself in terms of, you mentioned hearing. Some of my clients do have hearing issues. I know my wife says that I have them. That might be selective or not. I don't know. I don't want to get myself in trouble in case she's listening. But they say it's selective hearing. But you should approach seniors differently.
Great question.
Not only dealing with the barriers so they can easily get to your office, and if they can't, then we make house calls and come to them. But is there any special training that the nurses that are working in this ACE unit have or will have?
Yes. We have a program that we implemented a year ago. We were actually designated as a niche hospital, which is Nurses Improving Care for Health System Elders. Although it starts with the word nurses, it truly is an interprofessional approach to the care of the seniors. So that our education has been going on. We have nurses who have completed certification in geriatric resource nurse. That's what it's called, a GRN. We will have more of those who are educated for our acute care for the elderly unit. The important part of that is that we also need our patient care assistants. We need everyone who's in the hospital to really be tuned in to the specific needs of the elderly. And that's what we've done with this niche program, nationally recognized, evidence-based, a lot of web education. Okay. So able to actually get certification on the web where they get continuing education credit for that, et cetera. So yes, we have, you were part of our education program where we did end of life.
Yes.
We're pretty proud of that one.
That was a great experience.
Thank you.
And I think our doctors who participated in that seminar and got to hear Dr. Goldberg, Dr. Israel, who are great resources and so professional and so compassionate and trained and part of the GEM program, the doctors that were in attendance, who, like us as lawyers, have to have continuing education as well every year as well. But the surveys were so positive of the doctors that participated in those seminars. Yes, Denise?
And, Joan, I would like you to touch upon, because I think it's so important, talking about physicians, how your physician can refer or follow the patient in
That's
the
a good
unit.
point.
And I think the education point brings us to across the interprofessionals. Every one of us who's touching a patient when they come through our doors or on our telephones when we're helping them need to be tuned into the particular focus for the senior population. So with our physicians, we have geriatricians who are part of what we're doing. Dr. Israel is leading that, which is really great. We have Dr. Goldberg, and also we have Dr. Priya Angie at our Monmouth Medical Center campus. And here we have Dr. Sarah Ali, who is also a geriatrician here with Monmouth Medical Center Southern Campus.
And we just referred a client from Novy & Associates to Dr. Ali to visit her at the Monmouth South campus.
And it's important to know that the geriatric practice is not necessarily primary care. It can be. You can come there as your family doctor, or you can come for a consultation. You don't have to leave your doctor who you love, who's been taking really good care of you all these years. You may want to have a consultation with a geriatrician. Or your family doctor may say, you have now progressed a little further, and I would like to have some advice from this consultant, just like you would if it was a kidney problem or a heart problem or any other chronic issues that you might be facing.
Well, for example, I have clients at Novy and Associates who say to me, we talk about aging in place. We talk about long-term care. Should they get long-term care insurance? Can they afford it? Is it worth the expense and so forth? What other options do they have available? And we talk about what's the likelihood statistically of them having to enter a continuing care facility, whether it's on a short-term basis or a long-term or permanent basis. And we do talk about their family history. So the family history is one where I would say to them, frankly, you should speak to a geriatric doctor to talk about your particular medical history and that of your family, your ancestors, because those are criteria that can affect what may or may not be in store for you. But to get a consult, if nothing else, I'd want to know in advance what my prognosis might be so I can better plan. And, estate planning can be a very daunting and a very challenging responsibility, but it's also an opportunity. It's an opportunity to know what your options are. The clients that we serve, the patients that you treat, are truly our greatest generation. And you, our listeners, have made so many contributions to this society with the sacrifices you've given and made during the wars and the years you worked and creating a great society. And you deserve the opportunity to age in place. And you also have an opportunity to also leave a lasting legacy, whether it's to family, friends, and charity. And Monmouth Medical, part of the Barnabas system, does have a foundation, a very active foundation, of which I'm a proud member. And people that might be listening to today's show may want to become a part of that and help sustain our mission. And there are ways you can do that, which reminds me, Denise, we have a lot of very active, healthy seniors that volunteer for the hospital. That's part of the socialization. So if someone listening to today's show is bored watching what's on TV, reading about what's in the newspaper, which is very depressing, and they're tired of hearing about whatever is going on in the world, then they want to get out there and experience some new things and maybe give back to the community. What can they do if they want to get involved?
Well, we're always looking for volunteers, Bob. The foundation runs 3 thrift shops and a gift shop. They are located in Lakewood, in Manchester, and in Jackson. Thank you. And we're always looking for volunteers, even if 4 hours a day would be great. So you could call the foundation at 732-886-4438. We also could help you connect to our volunteer department within the hospital, and you could volunteer within the hospital as well.
So if you wanted to help greet people when they come into the hospital, if you want to work in the gift shop, what if you want to distribute magazines?
Yes.
Or maybe visit patients that are lonely and would welcome a visit while they're a patient.
We really, really appreciate our volunteers very much so. If we didn't have the amount of volunteers that we have, our load on our staff would be so much greater. They are there for the patients. They're just assisting them with small needs that are so important when you're in the hospital, just very, very important. Please, please think about volunteering. I would like to just make one comment before we conclude, because I know our time is...
Let me say one thing quick about volunteers, because that was one of my best introductions to Monmouth Medical Center Southern Campus. The volunteers are amazing. I actually have 2 who helped us with the education program that we did, so there are different things that volunteers do. And also we have a community health calendar. Our volunteer was really the one who said, we have to get this community health calendar out into the community. And she's the one who actually put it into the computer.
Wow.
And she's a major asset to what we're doing there.
Absolutely.
So thank you to our
ways.
volunteers. They do many, many different things, and
if you have, if you have a skill set from your prior life, if you were an editor or a writer, I mean, you could certainly help the hospital and the foundation so many different ways.
Or if you dealt with health insurance from an insurance point of view, helping people with appointments. Like my wife likes to, as you do, Denise, likes to cook, likes to entertain, loves to plan trips, has suggestions on programs that maybe we haven't yet thought of, because part of socialization is not only enjoying a good meal and getting good recipes, but hearing different things on travel and entertainment. And
Correct.
one of the things that a lot of my clients like to talk about is their stuff, their personal property, their furniture, their jewelry, where they bought that vase, when they were in Italy or wherever they were in the world. And seniors, our clients, are great historians and like to share their life experiences, and we love to hear them because we learn a lot more about life and themselves.
Correct. So just to wrap up for the hospital version of this, this program is something that we're bringing to this campus, and we're very excited about it. I know we just talked about geriatrics today. We talked about the GEM unit, the ACE unit. We talked about the Geriatric Outpatient Institute. We talked about niche nursing, the Better Health membership. All that is wonderful. But I want all of you to know that we take care of people that are not seniors as well. I don't want you to think that the hospital is turning into a geriatric hospital. It's just a program that we have some expertise on, and there's a need in the community. But, we're open for business, and you will get the same quality care as our seniors are, whatever your needs are. So I just wanted to make that clear.
Absolutely. And I'll just throw a plug because I know Monmouth Medical North in Long Branch has been for years also not only known as a teaching hospital and university, but it's also a place where a lot of babies are born. And my daughter is a geriatric she's a postpartum nurse, not a geriatric nurse. She's a postpartum nurse at Monmouth Medical North. So that's another part of the hospital's health care, the beginning of life. Right. But I want to remind our listeners that Inside the Law is brought to you every 2 weeks, every other Saturday here on 1160 WOBM-AM in Ocean County and 1310 in Monmouth County. And Novy & Associates has a busy calendar, and we're active in the community. We have a speakers bureau. And if anyone, as I said earlier, listening to today's show would like to learn more about elder law and elder care, and or to learn more about the Better Health Education Program that's available at Monmouth Medical Center, North and South, please call either their number, which is 732-886-4731, or if you'd like to volunteer at the hospital in some capacity or in one of their thrift shops, because you have special experience and skills that you'd like to share with others and add more diversity to your day. Mm-hmm. They welcome your input and involvement. And also future shows that we're going to be presenting on this radio station. 2 weeks from today, we're going to be talking about a very relevant topic I get a lot of questions on every day due to our economy, and that is learning more about reverse mortgages. Mm-hmm. And then 2 weeks after that, we're going to be talking about investing post-retirement. So, ladies, I want to thank you for coming on the show.
Thank you, Bob. Thank you so much.
And I appreciate everything you do for our community and helping us, God willing, continue to age in place. Paul, our sound engineer, thank you for fielding our calls. And ladies and gentlemen, thank you for tuning in. Have a great weekend, and we'll be back in 2 weeks with another edition of Inside the Law. Stay healthy and stay tuned. Bye-bye.